Well, good morning, everyone. My name is Jamie from insurerrates.com. I'm an independent insurance broker. At Insurer Rates, we help people all over the country understand the Medicare program and find coverage that fits their needs. And in today's live stream, I just wanted to take some time this morning and talk about the pros and cons of Medicare Advantage. There's a lot of videos being put out today about Medicare Advantage. Um, I have some thoughts after talking to hundreds of different Medicare beneficiaries. And more than anything, I'm hoping that either if people don't join on the live today, maybe they watch it after the fact, that they'll actually leave their thoughts in the comments below. And so, especially if you have some experience with Medicare Advantage, we'd love to hear from you in the comments. So, whether you end up watching this live or after the fact, feel free to share your experience when it comes to Medicare Advantage. So, let's just get some um, basics out of the way, if you will. So, when you are first eligible for Medicare, for most people, this is when they turn 65. You have to sign up for what's called original or traditional Medicare, and that's A and B. And how I explain that to people is think of it as the government side of Medicare. So, this is what you've paid into. It's different than Social Security, right? And you have to sign up unless you're going to take your Social Security benefits right away. You need to initiate the enrollment for original Medicare. One of the things that a lot of people don't realize is that um, original Medicare or traditional Medicare is not free. So most people in 2023 will pay $164.90 a month for their Part B. Most people don't pay a monthly premium for Part A, but there are deductibles. And that's just kind of step one when you're first eligible for Medicare. Um, I spoke with a gentleman the other day who called me. He said, "Oh, I'm getting ready to retire." He was 63 and he wanted to talk to me about Medicare. Well, I had to tell him unless you're have some sort, if you're on disability, you won't be eligible for the Medicare program till 65. So even as you're thinking about retiring, you want to keep in mind or take into consideration that even if you retire early, and when I say early, I mean before 65, or maybe before your full benefit for Social Security, you want to take into consideration, okay, maybe I had health insurance through work and now I'm going to retire, but I'm not Medicare eligible. Where am I going to get coverage for my health insurance? So that's something that you want to take keep in mind. So Medicare Advantage basically comes into play as a secondary option to traditional or original Medicare. So there's basically two paths to getting your benefits. You can choose to use original Medicare, and a lot of people will then add a Medicare supplement because original Medicare covers 80%. There's a gap in coverage of 20%. And that's where a Medicare supplement, also called a Medigap plan, can cover your costs when it comes to that 20% gap in coverage. And so you would pay, regardless of which path you go, I should mention you have to pay for your Part B. So you would sign up for traditional or original Medicare. Then you would have the option of adding a Medicare supplement plan to cover the 20% gap in coverage. And then you would also want to add Part D like drug plan as well, because traditional and original Medicare does not have prescription drug coverage. And so that would be one option. Like that's the option that my dad has, who's on Medicare. He has original Medicare, and then he has a supplement plan, and he has a prescription drug plan. That's one option. The second option then would be what is known as Medicare Advantage plans. So what Medicare Advantage does is it It's an alternative way to get your Medicare benefits through a private health insurance company. And so you can choose to have a private health insurance company manage all of your Medicare. And so it bundles it together and then it gives you some additional things that original Medicare doesn't give. For instance, a lot of times you'll see in advertisements vision, dental coverage, hearing, sometimes gym memberships, and most Medicare Advantage plans come with prescription drugs coverage included. And so every year, usually in the fall, you'll see a lot of advertisements go out, and they're from these private health insurance companies, and they're offering you their plan for the following year. And so um, the coverage varies. And when I say coverage, is that with Medicare Advantage plans, there's usually co-payments, co-insurance, and deductibles. So that you'll have to help pay for potentially. So a lot of times when we review a Medicare Advantage plan with beneficiaries, we go through and we look at who their doctor is, where their clinic is, the specialists that they may have, the prescription drugs that they take, and we plug all of that in because then a lot of companies can tell you, okay, here's what your t- potential total cost for the whole year will be, including premiums, drug costs, and that sort of thing. The problem is, or the challenge is, and this is maybe where a con of Medicare Advantage comes in, is um, if you're healthy, you can have very little out of pocket costs, right? You could just pay the monthly premium and you could be good to go. But if you start to need certain things, certain services, tests, God forbid you get sick with cancer or have to go to the hospital, now you may have to pay some out of pocket expenses. And that's one of the drawbacks, if you will, cons, because this is what people are looking for. So, um, so what you want to do is you want to know, okay, what's the maximum out of pocket? There's each plan has what's called a maximum out of pocket. So one of the things that I've been doing is I'll ask people, how do you plan on paying for that? How do you plan on paying for that out of pocket expense? Should it come up, right? It's part of financial planning. And so you can limit your exposure and have it much lower. Um, but, I've seen it where someone had a low premium Advantage plan. The maximum out of pocket was several $1,000s. They got cancer and now they have to use up that deductible, so to speak. That's what you're probably used to having it called when you're on an employer plan. The other drawback would be um, that if you, depending on the type of plan, you have to stay in network. So, for example, with an HMO, you have to stay within that network, including the primary doctor and the specialist. So, for some people, that's a drawback because they want to have more freedom, right? They want to be able to go to this person or whatever the case may be. If you do a PPO, you can there's some more flexibility, but you might go outside the network and pay more. So that's one of the things that I hear, and this is just things that I hear from Medicare beneficiaries when they're trying to make the decision process. The other thing that you have to remember is that, let's say when you're first eligible for Medicare, you have the option of getting a Medicare supplement plan. Well, and when you're first coming to Medicare, you can get a supplement plan without having to go through medical underwriting in your open enrollment, it's called. If you start with a Medicare Advantage plan and then let's say, a year or two goes by, you start to develop health issues, and now you want to get a Medicare supplement plan. This is something that I've experienced. Well, now you'd have to go through that medical underwriting, and the company can reject you based on health issues. And so you would have to stay within that Medicare Advantage plan. Um, so, but let's talk about some of the positives. of the Medicare Advantage plan, right? Because again, some of the positives, and I'm just looking at some notes here, is that there's some additional benefits that you might get, like the vision, dental, hearing. Um, a lot of times, there's some additional benefits like a gym membership, those sorts of things. So there can be some pluses to it. So a lot of people now are becoming more savvy to how the Medicare program works, and so they will find a Medicare Advantage plan that has a lower maximum out of pocket for the year, something they feel comfortable, but they may pay a little bit in premium, right? Because you could pay in premium 150 to $200, or you could pay $0 in premiums for Medicare Advantage. But typically, what happens is the lower your monthly premium, the higher your maximum out of pocket will be. Whereas if you pay more in premium, you can reduce your maximum out of pocket. So a lot of people that choose a Medicare Advantage plan will say, okay, well, I'll stay in network, right? And I'll have this Advantage plan that has a maximum out of pocket for the year of maybe $3,000 because they feel like that's something they're comfortable with, and then they'll be okay with wherever they have to go. So people ask me, and a lot of us who do Medicare all the time, what's best? Well, the problem is that every person's risk level is different. So some people don't want to risk not being able to go anywhere they want to go, and so they'll choose a Medicare supplement plan. Some people don't. That to them, that's not a risk. They're perfectly content to stay within the network of that Medicare Advantage plan. Some people want to pay one monthly premium, like a Medicare supplement, and know that what they're going to have left over from original Medicare is just covered. They don't want to deal with the co-payments or the co-insurance and the deductibles. So every person is different. Every person's view of insurance is different. I'm a dad. I have four boys, right? My view of car insurance is I can't wait to get them off of my policy and let them get their own insurance. So each person has to look carefully and weigh all of the options. So we have some resources here that we can send you if you would be interested in something that really looks at um, is kind of a third party and looks at the the pros and cons of Medicare Advantage from a consumer standpoint. So if you'd like a resource like that, you could just give us a call. Our phone number and our website will be in the description of this video, and we can give you some more resources to help as you're making the decision of what's right for you. Again, most people on Medicare are happy. That's the good news. Most people, there's research out there that most people that have either one, Medicare Advantage or Medicare Supplement, are happy and they're content with um, the coverage they have. So as long as you can do a little bit of research, um, maybe work with a individual broker like which is what we do, and our services are 100% free. You can evaluate all of those things and make the decision that's right for you. And the other thing is, um, you can change plans from year to year if you need to. Maybe your doctor retires or your plan changes and they're no longer in network. um, Maybe you move. A lot of people, when they get to be in their retirement years, they're going to move from one place to the other, and so that gives you an opportunity to look again and see, okay, what where the new places that I'm at, what Medicare Advantage plans are offered. um, so there's plenty of options out there for the average person to educate themselves a little bit, make an educated decision, feel confident with that decision, and then move on and get on with your life. Because nobody likes sitting around thinking about insurance all day. So, anyways, I'm going to wrap up this live stream this morning. Again, if you're watching this after the fact, and you have some thoughts on Medicare Advantage versus Medicare Supplement, we'd love to hear them in the comments below. If you like videos like this, please consider subscribing to our channel, liking this video, and sharing it with a friend. We just want to help as many people as we can and be as unbiased as possible. So thanks for watching. Have a great day.